Okay, let's get started. Good morning or good afternoon, depending on where you're located in the country. We're glad to have you join us for this live webinar series hosted by Mayo Clinic Connect. I'm Janine Kogel, a patient educator with the Mayo Clinic Cancer Education Program in Rochester, Minnesota. I will be moderating this session. My colleague, Angie Murad, will be assisting today with technical support, and she will help with us managing some of the questions that will be done at the end of the session today. If you have questions related to the topic, please type them into the chat function at the bottom of your Zoom screen at any point in the session, and we will take those towards the end. We want people to know that this session is being recorded so individuals who are not able to join us for this live session can watch at a later date. For those of you who would like to view this webinar again, the recording takes about 3 days to be edited and put on the video library tab on our cancer education page on Mayo Clinic Connect. As a reminder, our Mayo Clinic Connect is a digital platform where patients, family members, and caregivers can connect, get evidence-based information, and get access to information about classes and programs we offer. We encourage you to follow the Cancer Education blog on Mayo Clinic Connect so you can stay up to date on upcoming webinars and other educational opportunities. We will put the link to the Mayo Clinic Connect Cancer Education blog in our chat function now. This is a third presentation in a 3-week series on financial toxicity in cancer, managing the cost of cancer care. Today's session is on medical health financial planning. The term financial toxicity is used really to describe the treatment-related financial strain that's experienced by people with cancer. However, we know the financial impact goes well beyond active treatment costs. This series of presentations will address the many factors that can contribute to financial toxicity, identify strategies to manage debt, and tips for reducing financial burden, and outline financial resources that can help. Today's session will describe common costs encountered by patients with cancer, outline financial health strategies and techniques to manage debts, explore options for income and financial assistance, and will provide a checklist of ideas and items that can be helped to navigate the financial issues and stay organized. It's my pleasure to introduce our speakers for this webinar session. Ms. Amy, or she goes by Beth Williams, is a social worker manager for oncology, palliative care, medallion, and general outpatient social work in Arizona. She has been with Mayo Clinic since 2015. She has over 20 years of clinical social work experience supporting patients through complex medical care to adapt to change and continue to live their best lives. Jody Chuk is a patient navigator at Mayo Clinic in Arizona. She's been a patient navigator for 7 years, 4 of those with Mayo Clinic. She assists patients in locating beneficial resources that can help break down barriers to treatment. Angela Young is a licensed social worker by trade, but works as a patient navigator at Mayo Clinic in Rochester, Minnesota. She is also one of our subject matter experts and is joining us as a panelist today and be able to assist as needed for questions at the end of the program. All right, please join me in welcoming Beth Williams and Jody Chuk. Thank you.
Thank you, Janine. We're happy to be here this afternoon or this morning, depending on where you're joining us from. So we'll go ahead and jump into our subject matter for today. We are going to take another look at managing the cost of cancer care, focusing on financial health planning. So we'll start with the first slide. Go ahead, Janine. We're going to focus on speaking about what is financial toxicity. This is actually a term that was coined to describe what we are recognizing as a side effect of having a diagnosis of cancer and all of the related treatments or recommended treatments that come with it. Usually it comes with consequences that are described as financial toxicity or financial distress. The proper definition is the economic consequences of medical treatment. The financial burden or financial stress, it's a common concern over cancer care. Usually cancer care is longer term. It is the beginning of many changes that take place and take place over a longer period of time. Financial stress is recognized as something that can impact negatively the outcomes of treatment. So we do, as a team, as an interdisciplinary team, pay very close attention to what impact it can have on treatment and outcomes. Basically, the advocating principle is to plan, or to try to plan as much as possible, and to address issues immediately or as quickly as possible as they happen. Again, we really encourage you to rely and work with your team to help you. We have two patient navigators on this presentation, and I'm a social work manager, and we work very closely together to help navigate this journey. Costs of cancer care, some are obvious and some are not as obvious. You can see them listed here on the slide: treatments, medications, specialty provider services, health counseling services, rehabilitation during and after certain treatments. Sometimes you need durable medical equipment and home health care following surgery and/or other types of treatments. Those are somewhat obvious costs. Sometimes the non-obvious costs can include transportation back and forth, hotel lodging costs, childcare that may be needed, additional services that may be needed at home, housekeeping, yard work, etc. And then, of course, the impact on working or not being able to work, or not being able to work in the same capacity that you were able to do so prior to your diagnosis and/or treatment. Jody, do you have anything to add?
No, I would just reiterate what you've already said about us being a team and that there's a lot of people here to help you. Just acknowledging that it's probably difficult to talk about some financial concerns at times, but that the treatment team, that's what we're here for, to reduce the stress of financial toxicity. And we really do want to help and make sure that you're well supported.
Yes, indeed. Thank you. And just to piggyback on what Jody just said, the good news is that we can minimize the impact of some of these things with planning and ongoing discussion. Next slide, please. So what does this mean, planning ahead? Oftentimes, any diagnosis, but an oncology or cancer diagnosis, it just immediately indicates that we need to understand fully what are our insurance benefits, what are the coverages available for long-term insurance, any other insurances or benefits we may have through employers, what is short-term disability, long-term disability, what does federal disability look like? There's multiple possible benefits and assistance that is out there, but it is important to understand what each one means. Often when you are receiving this diagnosis or trying to navigate treatment, it's not ideal. It's not what you want to do, is to jump into, becoming an insurance expert or a benefits expert or a financial planner. That's why we have the team of people available to help. And also, it's important to look around your immediate circle to figure out who else can be helpful to you, whether it is your immediate family or a friend or a caregiver that can help navigate all of this. Planning ahead can include speaking to your insurance company, your health insurance company. Oftentimes, there are customer service people available that can help you walk through your benefits and understand what is paid for, what's not paid for, what the copays are, et cetera. You can also request a case manager in some instances with insurances that can assist with diagnoses such as a cancer diagnosis. It's helpful to kind of think about it like a project, thinking in terms of, okay, what are the concerns? And really creating a budget and tracking, okay, where are my expenses? What are my potential risks? And creating a system that works for you to stay organized. Some people are paper people and they like to have the tangible system with folders and binders, et cetera. Some people are digital people, everything on the computer, or some people are a combination of both. But just to really get that going immediately, to keep everything in one place accessible so that you can pull up everything, look at everything, and understand what's going on. Seek out resources. Anything to help reduce costs. There's a lot of options out there related to even non-direct costs like lodging and transportation. Sometimes there's financial assistance available with the cost of gas, for example. Other things that are options. And again, this is one more time to make sure you're speaking with your team. Managing debt. And so debt is something that if you are, again, understanding what your costs will be, you can pay attention to, okay, how can I manage this the best way possible? Know what your out-of-pocket maximum is related to your insurance. Talk to your financial representatives within the business offices here at Mayo Clinic, for example. We have patient financial accounting services. They will sit down and talk with you. They will go through your potential bills, your estimated costs, and figure out what to do. Don't ignore medical bills. That is one of the most important pieces of advice that we can give you. All of our inclination is to kind of not deal with things that are unpleasant or just put off or procrastinate or not jump into looking at medical bills. Oftentimes, when they come in immediately, you're paying attention to what they are and dealing directly with what is being said is due. You'll find, in fact, insurance hasn't, totally cleared. There may be more that's coming from insurance. It may not be the total amount that you see on the paper, but it's very important to stay in communication and deal with medical bills directly. Stay in communication with the financial billing office. Stay clear about what your current budget and debts are, what your income is, and how it will be impacted by your diagnosis and treatment. Explore strategies to pay bills. Oftentimes, utilities will offer grace. Mortgages will offer grace. If you have had a diagnosis and now need treatment and are not able to put in the hours or do the same type of work you were able to do before, they'll work with you on a reduced billing, or stretch out your payments or do something for you so that it's not, so you don't get into a situation where you're in trouble. Oftentimes with medication, depending on what your diagnosis is and recommended treatment plan is, there may be medication payment plans or assistance available, subsidies available through the pharmaceutical companies that will offset the cost of medication. And again, it can begin with a conversation with your team. And then there are different debt counseling and payment plan options available for different types of financial issues. Jody, do you have anything to add?
Nothing really to add, Beth. That was great. I just wanted to kind of reiterate, I guess, again, sometimes if we put things off, like looking at bills, or it's really something stressful that you don't want to deal with in the moment, and we put them off, it just causes even more worry and even more stress than handling it in the moment. So maybe just a suggestion could be like to set aside time each week to kind of go through those things when you know for sure you have to just sit down and take care of them and organize, go through mail, things like that. Maybe that could be helpful.
Agreed. Absolutely. It's better to just look at it straight on, maybe just schedule in your week, 20 minutes, 30 minutes, this is bill time. And, or if you are fatigued and not able to completely pay attention to it, have that second person with you or assigned to, this is bill time for you. Absolutely. Thank you. Next slide, please. So some of the creative income or financial options to consider. These are things that others have done, patients have done in the past that have helped. You can reach out to nonprofit organizations and community resources in your community. I mean, we've had different examples of church groups, of just concerned patients or patients who have been through treatment who have benefit funds available. There's just different things that are available. And again, I would say start with speaking with your team that can offset some of the costs of treatment. Sometimes people consider using retirement funds, depending on the contract or your arrangement that you have with retirement funds. Sometimes a cancer diagnosis or a diagnosis of a serious medical situation can be considered a reason to do withdrawals. Again, I would encourage you to talk with your financial planner related to retirement funds, also with life insurance policies or reverse mortgages. Those would be conversations to have with your banker, financial planner, anyone that might be advising you about your savings or incomes or I'm sorry, investments. Other things that have been done that have been creative, fundraising opportunities, something similar to a GoFundMe. We've had different patients do different things related to this. Communities sometimes come together, on behalf of the patient or their families and do different types of events to help offset the cost of treatment or offset a secondary cost not directly related to treatment, like to help pay for housing or transportation, et cetera, related to treatment. Anything else, Jody?
No, those are just I guess adding that you and I, both as a social worker and a patient navigator, we call on these resources all the time, the community resources. And so if you're a patient and you're looking for some assistance, there may be assistance out there that you're not even aware of. It's something that we were aware of. Some of them we can do research to find, in your particular diagnosis or your particular situation, if there is anything out in the community. A lot of these organizations are funded by, fundraising events and things like that. So depends on what time of the year and how much of the funding is available, but definitely worth checking into for sure.
Absolutely. Thank you. Next slide, please. So this is just to reiterate, it is important to have direct, open communication with your cancer care team as soon as possible. I mean, do not wait if you have any type of concern or stress related to paying bills, trying to take care of just costs to live, costs of medication, any other expenses. There's also additional assistance available for navigation and guidance for employment. Cancer diagnosis is recognized as a disability under the Americans with Disabilities Act. It does open up different types of benefits potentially. It's important to have this conversation again as soon as possible, especially if you're looking at a situation where you have to reduce your hours or you may lose your job. Or it's just a loss of income or insurance related to employment. We have an excellent resource sheet that is available. I'm sure Janine will point that out again. One of the resources there is called Triage Cancer. It is an excellent resource related to all of these types of issues. And again, I just cannot emphasize enough, it is important to speak up. Do not sit on your concerns. Do not worry in silence. Oftentimes, the things that we are anxious about related to diagnosis and treatment, especially when it comes to finances, can be helped and assisted, and it will feel better. You do not need to be anxious about these things. We can help you. Please ask questions. Reach out as questions arise. We are all accessible via the portal. We all have email. We all are related or connected to the phone. So we are easily reachable. Let's see. And like I've said previously, others who can help the people on this presentation, your navigators, your social workers, also the business office financial counselors, they are also available to help. So I will say again, please let us know if you have questions or concerns. Jody, do you have anything to add?
No, thanks, Beth.
Wonderful. Okay, next slide, please. I guess what I will say when it comes to this suggestion is to pay attention to the bills as they come in. Jody said this earlier, don't let things pile up. It's much easier to look at things in a smaller in smaller bites than one giant pile of stuff when you're trying to take everything in. Pay attention to the bills as they come in. Call immediately if you notice anything odd or wrong or an amount that you think is not correct. You will always with insurance get an explanation of benefits and EOB. Use that against the bills that are being sent. Make sure they match. If they don't, then you can call your insurance company and or patient financial services. If you have to submit claims, often, there's availability. You can even do it on your phone. You literally can just take a picture and send it in. Do it promptly, even if you're not sure that the expense is covered. It's easier to go back and say, okay, well, that is okay. Let's do this. We can add to whatever you might need for information. If you can even just keep piles, like a completed record of submitted claims. Again, if you're a paper person, just keep it in one place. If you're a digital person, just scan it or take a picture of it with your phone, immediately file it. But do keep copies of everything. Letters of medical necessity, EOBs or explanation of benefits, any bills you've received, receipts showing that you've paid, any FMLA paperwork, or any correspondence with the insurance company and or patient financial services. Anything else to add, Jody?
I always just tell patients that if they have someone that they trust, family member, neighbor, friend, whoever, if there's somebody in your life that you really trust with this kind of information, it's incredibly helpful to have someone just guide you and a second opinion type thing, and someone to help you keep track of paperwork, because sometimes you may just get overwhelmed with everything that's going on with your treatment plan and things like that. And it's always nice to have that extra person, but of course, only if it's somebody that you truly trust. That's all I wanted to add. Thank you.
Oh, completely agree. Absolutely right. It's helpful if you have a second set of eyes, ears, pair of hands to help you, a person that you trust, particularly with these things. Absolutely right. Next slide, please. This is a checklist that can help you walk through all of this. And again, I think of Triage Cancer because they have similar checklists related to different topic areas with cancer treatment and managing finances and employment, et cetera. But this is wonderful. And you can see it kind of lists out everything to help you walk through this issue in an organized way so that it just becomes easier to manage. It's always easier to take things in smaller steps or smaller bites. You can see you just want to have a basic understanding of what the insurance terminology is. You want to understand what your insurance is paying, what it's not paying, what your responsibility might be. Keep on top of your paperwork and be aware of any denials or appeals process. The advice we always give is if you are denied initially, always appeal, always appeal, always appeal. Don't ignore bills, keep a record of everything. Just make sure you have a good handle on your overall household budget and spending. Be aware of what you might need, and please be in conversation with your team so that we can help you. We want to avoid the loss of health insurance as much as possible. And it's helpful to be aware of your employer's policies and benefits, depending on what happens with your ability to work. If you can continue as you were with your same number of hours, that's okay. But if you can't, we want to make sure you have a clear understanding of what your rights are, what the employer's policies are, and what you might need to do to make sure that you are covered. If it happens that you will be losing your health insurance coverage, it's important to understand what COBRA options are available if you're eligible and if you plan to use COBRA. There's also usually some consideration for costs with COBRA. They tend to be higher, and sometimes it does require a timely application. So again, it's important to be aware of what these options are. And we just one more time, please consider discussing these issues as quickly as possible with your team members. Jody, anything else to add?
No, thanks, Beth.
Thank you. Next slide, please. And it's questions and answers. So Janine, do we have any questions?
Couple questions here. I've heard that FMLA isn't paid time off. Is this true? And do I get to keep my employer insurance when I'm on FMLA?
So FMLA is a federal protection of your job. Basically, it will protect your position and hold it in place while you get treatment. It does not guarantee payment. That is determined by your employer and the contract that they have with you. Sometimes employers will offer short-term disability and then long-term disability, depending on how long you're out and what you need. FMLA, though, is a protection of your job, and it will hold your job, your current position in place for up to 12 weeks continuously, or it can be taken intermittently, which means that, you need time off, for 3 days of treatment, and then you can work full time again, et cetera. So it'll be those 3 days will be protected time is how is the language. Did I answer the question? I don't know if there was something I missed with that.
I think that was good. Another question is, someone asked, can I have someone help me keep all this paperwork organized and all of this information? If so, how can I give them access to my records so they can talk with staff on my behalf when they make calls in? For example, like calling the business office.
So you can have someone that you trust, you identify as a trusted person in your circle, do this for you. We can help get you connected to the business office, for example, or resources, but a social worker or a patient navigator can't necessarily be that person to organize all your paperwork. Angie or Jody, if you want to weigh in on this, that would be great, but that's my understanding. It's if I'm hearing the question correctly.
Yeah, I would agree with you, Beth. It would be something that we would identify the resource and make sure that you're connected with the resource. But as far as like having someone trusted, we would ask that it be a family member, a friend, someone that you personally know, and then make sure that you connect with one of us to make sure that we have the proper paperwork so that we can speak with that person, or we can route that person to other resources if you want them to speak on your behalf.
Yes,
I think the only,
go ahead. Sorry, Angie.
I was just going to say the only thing I would add is that we just need to have that, like a formal release of information, essentially, is the piece of document that we would need to have on file for whomever you identify as needing access to your records, to have those conversations on your behalf.
Exactly. That's exactly what I was going to say. Thank you.
Oh, we have a question is, who is the best person to talk with about FMLA, intermittent FMLA for ongoing cancer care? HR, social worker, patient navigator, example, FMLA for procedures and appointments.
So if you are employed, you want to reach out to HR right now to request FMLA paperwork. And then you would bring the FMLA paperwork to your appointments and let them know that you need assistance with the FMLA paperwork. And it can be patient navigation, it can be social work, whoever, and whoever that person is, we can help get you connected so that the medical piece of that is completed and returned.
Great. There was a comment here. It's talking about looking at the marketplace for health coverage, often cheaper than COBRA, and if necessary to get, then no waiting period. and with financial assistance might be free. Any comments about that?
Sometimes it is I'm thinking that the person's referring to instead of COBRA, or if you lose your health insurance, you can go out onto the marketplace and locate a different plan. And that is true. Sometimes it is cheaper. It depends on the person's circumstance for sure. It's certainly an avenue to investigate. Jody or Angie, anything to add?
I think the only thing I would add as well, it is certainly another option. As Beth mentioned, I think the time of year in which a patient is actually looking to switch insurances really can be something we would encourage you to factor in, because while the monthly insurance premium may look less expensive than COBRA, if you look at what your total out-of-pocket expenses for the entire year, if you are nearing the end of the year, you may be better off paying your higher COBRA premiums if you've already maxed out your insurance total out of pocket. So if we look at what your total cost is, while your monthly insurance premium might be less on marketplace, it may not be less expensive if we look at the whole picture. So that's why it is really important to have some of these conversations with your care team, social work, patient navigation, financial counseling office, to kind of make sure we're thinking through all those different components that a lot of patients don't understand because they haven't had to look this deep into their insurance.
Mm-hmm.
Okay, thank you so much. Oh, we are getting a few questions. Sorry. There. Sorry, I thought it was a question, but it is not. So, okay, I think we can wrap it up. I wanted to thank our speakers for their great presentation today, and it was very informative. And thank you to all of our attendees who participated today. Have a great rest of your day, and thank you very much.